I know so often, now obviously there are any number of illnesses, but I would imagine cancer, just by the very nature of it and how sometimes predictable it can be in terms of we know at a certain stage, more than likely a person has X number of weeks, months left. A lot of the people you see are cancer patients, and pain is often a big factor there. And I know pain management, dealing with pain and the anxiety that not only the pain brings, but how do you deal with it brings for people and for families is a lot of what happens in hospice care. Is that correct?
It's probably the most important thing. Anxiety is, the unspoken one. Pain is the one people are willing to talk about and really, really want control of their pain. And we really have to do a good job with that. But once you do, people are comfortable, they start to relax, and they trust. And they know that they won't be so out of control. I think people are really worried about being out of control, and studies show that people are less afraid of dying. Many studies say 50, 60% people will say, yeah, I'm afraid of dying. But 80, 90% of people say, I'm afraid of being in pain, short of breath, or being alone. And those things really get people right in their heart.
And I think of your individual caseworkers, your individual people who are in the homes with people, and how hard, obviously very hard for the person who's sick and their family, the person who's in the process of leaving us, but very hard for the workers too, I would think. There's got to be a stress level there.
It is really hard. It's very stressful, but it's also very rewarding to be able to help people at a time like this. It's really a privilege to walk into people's lives. The skill set is high, and like you said, managing pain, helping families with chores. We have wonderful volunteers that help with chores, sit with people. We have home health aides that help with bathing. So it is very difficult, but the folks that choose to do it do a wonderful job at it. And people's stories are amazing, and we are able to go in and hear about just amazing stories. This past weekend, we took care of a man who was a veteran, and his son told me his story about when he was a World War II veteran and a prisoner of war. And so it's amazing. It might surprise people to know that 1,800 veterans die each day in this country. One of 4 people that die in this country are veterans. And so, we kind of walk in people's lives and hear their stories, and it's a really amazing story. But the staff, it definitely takes its toll. We all support one another in this journey, and so that helps a lot. I think that it's a team approach, and I think that any one of us could never do it alone.
We do have some calls online. We're going to get right to them, but I just got kind of an interesting insight into what you folks do, because the folks in control room told me that a couple of people call up and basically say, I can't go on, I can't talk about this. And that's, there's a pain, and there's a psychological as much as physical. Let's go to our caller from Springfield who been kind enough to wait. Go ahead, Springfield. What's your question or your comment, please?
My question is, yesterday I had a kidney surgery where they blasted out 2 kidney stones the size of golf balls. And today I got a fever of 100.9, and I threw up all my regular medication.
Oh dear, that's
wow.
Difficult situation.
You've had a hard couple days. I hope you've called your doctor about that, because they'd want to know if you're having nausea or vomiting. The good thing I'm hearing about your question, though, is that this is something that will lead to your kidneys working better, and without those stones, you'll be feeling more comfortable. So luckily, this isn't a life-threatening illness.
Thank you very much, caller. I'm glad we were able to have that caller get through to you, because there's an example, not a person in hospice care, and we sure hope she gets completely better, but
we want her
you were able to hopefully give her a level of comfort there, ease her concerns, which will be very real. With
Absolutely,
symptoms.
because you go through a procedure like that, it's big no matter what. And just to have somebody vocalize that they're with you and they support you, that helps. Or somebody to hold your hand. I think there's nothing like touch. So I hope somebody's there with you tonight to give you a squeeze and say, okay, you're going to get through this. But make sure you do call your doctor. That's very important.
Yeah, good luck with that caller. We've got a couple of emails And I'll go to a phone call because this person's been waiting a couple of minutes. Granby, go ahead. You're on the air. What's your question or your comment, please?
Are you giving care to the patients who are currently undergoing chemo or radiation?
Great question. Yes, indeed we are. And that brings up the answer of what's the difference between palliative care and hospice. Palliative care, as Maureen said, could be for somebody who's in the last few years of their life, whereas hospice, usually by the regulations for Medicare, are the last 6 months or so of life. So if somebody's getting chemotherapy, they might have more nausea, they might have more pain, they might have more side effects of medicines, and palliative care would get in there and help them with that. It wouldn't say you couldn't do any treatments, it would say we're here to help you do the ones that you want to do. And you just let us know if your goals change, and then we can come in more or less to help you with that.
Yeah. I think the similarities between hospice and palliative care are that they both focus on symptom management, managing pain, nausea, so forth, and they also have a family and patient focus. The major differences are that with palliative care, there isn't as short of a prognosis requirement. In other words, people can be not necessarily in the last 6 months of their life. The other difference is in hospice, it's more of a comfort care plan of care, where palliative is people getting active treatment, going back and forth to the hospital. For the most part, folks on hospice stay either at home or in the nursing home, wherever their home is, and are usually getting a different type of care. It's not a lot of IVs, transfusions, chemotherapy, that sort of thing. They're really on a supportive track.
Believe it or not, we got 8 minutes left. We've got quite a few emails, so let me start working through them. Here's one that, well, an important question, but kind of breaks your heart. Would a young child be a candidate for this type of care?
Absolutely. Absolutely. More than anything, we really deal mainly with adult-related illness. The hospice at Bay State works with children, and it's even a super specialty among our specialties. And people, if they're a child going through treatments, whether it's a cancer or something else, they and the family need extra help. And then if they're on hospice, all the more so. So kids, absolutely. We'd all like to just scoop them up and hug them and tell them it'll be all right. But when you know they can't be fixed, they need extra care.
I have an email from a health professional, and you know what, Maureen Groden, I'm going to turn this one to you because it comes from an RN. Okay. She says, as a nurse and a family member, I have found it difficult to work with others and pain meds. Many people are afraid of addiction to the pain med. The thing that concerned me more were caregivers afraid to give pain med because it might be too much and end a patient's life. What's a good way to approach these concerns? I was always worried people were under-medicated, not only because of their fear, but because of caregivers' fear. And she actually, we'll tell you the name after off air, which says, hi, Dr. Z. So I think she wants to hear from both of you. But, that's a concern for your people, I guess.
It's a common problem. There's a lot of myths around giving pain medicine, that it's going to cause someone to die, that the side effects are going to cause people to be more miserable. Really, a lot of diseases that we see, you oftentimes need to have pretty strong pain medication. And it's a common problem that we see that a lot of nurses have difficulty with giving pain medicine. And so we try to educate people all the time about how important it is to provide the medication, that oftentimes people are on the maximum amounts of their medications, whether they have heart disease, lung disease. If they have a lung disease, they're on the maximum amount of medication to facilitate their breathing, that oftentimes it is the stronger opioids that actually provide more comfort type medication. But it's a real problem when we educate people all the time about it.
And we can easily say that if you're on hospice and you're in the last 6 months of life, it's impossible to become addicted to your meds. And my definition of addiction is you're willing to rob a bank, lie, cheat, and steal to get more of the medicine. Instead, people on hospice, if you have pain and you have this much pain, you better have this much pain medicine to balance it out. If it's not enough, you're going to still feel lots of pain. If it's too much, you might feel groggy. So we keep adjusting to make it match the amount of pain you have. And if that pain changes day to day, you have to change your medicine. So it's not an addictive problem. Somebody in palliative care, you might be with palliative care for a few years. Could you have addiction there? It's still very difficult because you have pain and you're getting that medicine for the pain. So we don't run into that problem very much at all.
Very good. An email from a gentleman who wonders, are there guidelines for when doctors should refer a patient to hospice care? Are there problems with referrals coming too late, such that hospice staff doesn't have time to properly prepare the patient and family for the inevitable? That's an interesting question.
I'd like to say that if there's one message I'd like to get across today, it would be that many, many, many more people are eligible for palliative care and hospice that actually are able to access this service. That nationally, the length of time that most people are in a hospice program is about 21 days. So they're eligible for the service for up to 6 months and sometimes longer. So I think what happens is people aren't having the conversations, people aren't familiar with what the guidelines are. What is a sign that, for example, someone with Alzheimer's disease is in the last 6 months of their life? Or what are the signs that someone who has emphysema? And so our agency, VNA Hospice of Cooley Dickinson, is doing a lot to educate area physicians and nursing homes and so forth on what those signs are.
Okay, now we've got a full load of calls and a couple emails. Let's see what we can do in about 4 minutes left, a little less than that. Bolton, Connecticut, what's your question or your comment? If you can be brief. Go ahead, Bolton.
Yes, I have a comment. A few years ago, my mom got sick, and I had 2 sisters. One passed away since, but they were afraid to come around her, and my husband was afraid. My kids were too young, and if it wasn't for hospice, I don't know what I would do, because I was never around a dying person, and they were there for me. And that was the last 24 hours of her life, but I just couldn't handle it. And they were there for me, so I really thank you.
We thank you for calling. That's a beautiful testimony, and that's what it is. Nobody goes to school to learn what to do about end of life. If we go back to 1900 and your great-grandparents or mine, well, a lot of people died at home and people had experience. In our high-tech society, people have less experience. People don't know what to do and they can get overwhelmed. So they may just avoid being with somebody, but that's the beauty of a hospice. The staff are not worried about it. They're very comfortable. They're there to help.
Real quickly, a person asking about, are there after-death services, bereavement services available, whether it's through hospice or palliative care agencies, hospice agencies? What can you tell someone briefly about that?
Absolutely. It's a critical part of the program that folks that have hospice services, we keep in touch with them for up to a year, 13 months actually, after the death of a loved one. So it's a huge change in people's lives. So we have a series of phone calls, newsletters, bereavement groups. So that's a critical part of the program. We have a website too. It's www.vnaandhospice.org, and there's information about bereavement programs. Our bereavement coordinator also can provide information about resources throughout the valley, but it's a huge piece of the program.
Very good. Let's go. We have one call. We have 1 minute. Let's see if we can do this. Lennox, go ahead if you can be brief. Lennox, you're on.
This is Walter. My wife has cancer. She just came up with it, and we are grown children of this lady. And we're at a quandary. What type of choice do we have between radiation, chemo, or surgery? And we're all just guessing what way to go with.
You got 30 seconds to comment. What would you direct a family with this concern?
I would definitely say talk to your oncologist, the cancer specialist, because they have the most experience to say what made the difference, what might make the difference, and how hard it is to go this treatment, that treatment, or the other. And if you kind of get an idea of what's going to be the benefit and what it might cost you to try to do it, then you'll have a better idea to make an answer.
And that is all the time we have. Let's quickly tell you more information. Go to WGBY.org, click on local programs, some web information and web links there. Next week on Doctors on Call, the focus, vascular surgery. Anything you want to ask us, tell us, suggest future topic, call 413-781-2801, extension 268, any time of the day or night, any day of the week. We'll get your message and we'll get back to you or try and help you out with the program you're looking for. So thanks to our guests. We'll see you next week on Doctors on Call.
Doctors on Call is brought to you